Yes. The effect on the first pass metabolism and bioavailability due to old age. In elder peoples, there is a decrease in the liver mass, decrease in the liver blood flow, and activity of enzyme cytochrome P450. This enzyme cytochrome P450 is responsible for the metabolism of the most of the drugs, and this decrease in all may leads to the decrease in the metabolism of drug. If there is a decrease in the enzymes, no enzymes are available, the drug will be not metabolized, and if the drug is not metabolized, it will be not able to excrete. And where is the drug in the body, and it will may leads to increase in the absorption, increase in the plasma concentration, and may leads to adverse effect of that drug. What is the changes in the first pass metabolism? If there is a decrease in the first pass metabolism, decrease in the first pass metabolism means decrease in the workers, decrease in the labors, no work will be done, no drug will be metabolized, and no drug will be excreted. So where is the drug? In the body, and it will increase the concentration of the drug into the blood. There is one example here, propranolol. What is this propranolol? This propranolol is the beta blocker. You studied this propranolol as a non-selective beta blocker, and it is generally used in the management of the hypertension. Yes. What is the first pass metabolism of the propranolol? This drug is extensively metabolized by the first pass. Suppose if any person is take 10 milligram tablet of the propranolol, which is a beta blocker, it is used in the management of the hypertension. If any patient, adult patient, healthy patient takes the propranolol, example 10 milligram, so only 2.5 milligram reach to the blood. How much amount? Only 25%. Only 25% will be reached to the blood, and remaining 75% propranolol is degraded in the metabolism and excreted. So what is the extensive first pass metabolism? The checkpoint, at the checkpoint in the liver, this propranolol is extensively metabolized after oral administration of the 10 milligram tablet. Only 2.5 milligram will reach to the blood, and remaining 7.5 milligram, 75% drug will be degraded into the metabolism. So what is the concentration for the propranolol? Only 25% drug will reach to the blood. Only 25% drug will be absorbed. So what happen if we give this propranolol to the elder person more than 65 year of age? What will happen? In the elder person, there is already decrease in the metabolism due to decrease in the liver mass, decrease in the liver blood flow, decrease in the activity of the enzyme. So what will happen? It will increase the plasma concentration of drug, because there is no metabolism, instead of 25% it may reach to the 50%. 50% of drug will be reached to the blood systemic circulation. So it will be causes increase in the plasma concentration of drug with extensive first pass metabolism as propanolol. So what is the case? What is the scenario? How can you differentiate this scenario in adult patient and elder patients? For the management of the example, for the management of the hypertension in the adult, healthy adult, I need 10 milligram propanolol, and out of the 10 milligram, only 25% reaches to the systemic circulation and it is pharmacological active. Okay, for 25% means 2.5 milligram propanolol is okay. But the same dose you are giving to the elder person, six more than 65-year-old, and in elder people there is already metabolism is decreased, the metabolism rate is decreased. So the drug is not metabolized properly in elder people. Example, propanolol is not metabolized properly. So instead of the 25%, it may reach to the blood near about 50%, and this 50% may responsible for the adverse effect. So as per, we have to change the dose of drug in elder as compared to adult. There is second example, there is a decrease the activity of prodrug. Now what is the prodrug? It is very important. Here there is one another example, prodrug. Prodrug means the drug which is active, the drug which is inactive, drug which is inactive, but when we take orally, the liver after metabolism convert into the active form. Active form is which will create its pharmacological effect. So here the most important part is liver. The most important part is liver. We need the healthy liver with normal metabolism to convert the prodrug into active drug. Prodrug means pharmacological inactive. It needs the liver enzyme to convert into the active form in the body. So that's the role of liver is very important. Role of the metabolism is very important. And if the in adult person which is having the normal metabolism, and if we give the drug, it will converts to the active form. But in the elder people, we give this prodrug. In elder people, there is already decreased metabolism. The work of the liver, the work of the enzymes already decreased due to age. So what will happen? There is decreased activity because these elder liver enzymes and metabolic states are not able to convert this drug into active form and decrease the activity of prodrug, which having the extensive first pass metabolism. And we have the one example here, enalapril. Enalapril, what is this enalapril? It is ACEI, angiotensin converting enzyme inhibitor, and this category of drugs are used in the management of the hypertension. So if we are using the NLRP to the elder people and it is pro-drug, so its effect will be not accurate as in adult. So avoid the use of the pro-drug, this enalapril to the elder. We can give its another derivative. Example, lisinopril, captopril. These are not pro-drugs. From this category, angiotensin converting enzyme inhibitors, only enalapril is a pro-drug. So it should be avoided in the elder people due to decrease in the metabolism. And this pro-drug needs the metabolism to be active in the body. Now, this is about the metabolism. What is the effects of the metabolism? Now, bioavailability, we can say bioavailability. Now, let us see the drugs in the plasma. Drugs are found in plasma as free and protein bound. When we take the drug, some drugs are free and some drugs are bound to the protein. Now, which part is pharmacological active, free part or bound part? Sorry, yes, free part or bound part? Generally, the free part of the drug in the plasma is considered as pharmacological active. Which one? The free part. If the drug is bound to the protein, it is not pharmacologically active. Generally, the acidic drug, diazepam, the nature of drug is acidic. Diazepam, this is the drugs generally used. We can say it is a sedative drug. Sedative drug, it sedate the patient. Diazepam, and this diazepam generally we are utilizing in the anxiety, in the some neurological condition, in the epilepsy, in the seizure, to sedate the patient. Diazepam. Diazepam is from the category of benzodiazepines. The main category is benzodiazepine. And this diazepam, benzodiazepine, sedate the patient, calms the patient. It is acidic drug and it binds to the albumin. So generally acidic drug binds to the albumin and the basic drug binds to the alpha 1 acidic glycoprotein. Basic drug binds to the alpha 1 acid glycoprotein, and the example of basic drug is propranolol. So how it affect? Let us see. Distribution of the drugs. Now it is very important. Uh, you should know the volume of distribution. What is the distribution of drug? Transfer of the drug from blood to tissues. It distribute, as the name indicates, distribute from blood to the tissues. For orally administered drugs, distribution begins after absorption and first pass metabolism. Obviously, checkpoint. After the checkpoint, distribution. Distribution is represented by the volume of distribution. So, if there is a VD, it is abbreviated as VD, volume of distribution. Relationship between the amount of drug in the body and its concentration in the plasma. Lipid soluble drugs are distributed to body fat. If the drug nature is lipid soluble, soluble in the fat, so they are distributed to the body fat. They are going to the body fat. And the water soluble drugs are distributed to the body water. And here is an example: lipid soluble drugs are distributed to body fat. Example, diazepam. What is a diazepam? Diazepam, it is the drugs generally used for the sedate the patient in the in the management of the anxiety. And the uh, water soluble drugs are distributed to the body water. Example, gentamicin. What is gentamicin? Gentamicin is an the aminoglycoside antibiotic, antibacterial antibiotics to kill the bacteria, gentamicin. And some drugs are concentrated in the muscles. Yes, muscles. And the name of drug is digoxin. What is this digoxin? Digoxin generally glycoside. It is used in the management of the congestive heart failure. These digoxins are used in the management of congestive heart failure, CHF. So these drugs are distributed according to their nature, because diazepam is soluble in the fat, lipid, so it is distributed to the body fat. Gentamicin is water soluble drug, so it is distributed to body water. And the digoxin, when we give the digoxin to the patient, it is generally deposited into the muscles, into the muscles. So let us see what is the relation of this distribution in the elder people by examples. Effect of drug on the distribution. What happen in the elder people? Due to age, there is increase in the body fat. The body fat is increased. If the body fat is increased, what is the effect of the diazepam, which is lipid soluble drug? It will increase the volume of distribution of lipid soluble drugs. Example, diazepam. Why? Why there is increase in the volume of distribution of the lipid soluble drug into the elders? Because in the elder there is increase in the body fat. More body fat, this drug will be deposited into the body fat, so increase the volume of distribution of lipid soluble drugs. Lipid and fats both are same. In the elder peoples, there is decrease in the body water. If the body water is decreased, so volume of distribution of the water soluble drugs like digoxin and gentamicin will be decreased. Gentamicin and digoxin, these are soluble in the water. So if the in the elder person the body water is decreased, and if we give the drugs of like gentamicin and the digoxin, the volume of the distribution of these drugs will be decreased. Third example, in elders there is decrease in the muscle mass. Decrease in muscle mass. If the muscles are decreased, so the drugs which are concentrated into the muscle like digoxin, it is generally concentrated into the muscle. So volume of distribution for the drugs which bound to the muscle like digoxins will be decreased. So what is the question? Why there is decrease in the volume of distribution for digoxin? Because digoxin is concentrates in the muscles, and in elder peoples there is decrease in the muscle mass. Fourth example, there is decrease in the serum albumin. Now albumin, as we discussed, the acidic drugs binds to the albumin. Acidic drug binds to the albumin. Now if his albumin is decreased, so drug will not able to bind to the albumin. And if the drug is not able to bind to the albumin, it will increase the free concentration of drug, and this free concentration will responsible for the adverse effect. How? Most important example, Listen carefully. Listen carefully. The free drugs are pharmacological active and the bound drugs are not pharmacological active. Free drugs are pharmacological active. If the acidic drugs are bound to the albumin, and in elder people there is decrease in the serum concentration of albumin, the albumin is not available to bind the drug, and if this acidic drug is taken by the elder people which is not able to bind to the albumin, its free concentration is increased in the blood, and this free concentration of drug is responsible for the adverse effect. Example, we will see the example: warfarin. Warfarin is coagulant. It is generally used in the management of the bleeding. Warfarin, it is used as an anticoagulant. This is the medications. It is an the anticoagulant. Means we can say it is a blood thinner. It is an the blood thinner, anticoagulant. It will prevent the blood clot. Okay. And if we give the warfarin, which is anticoagulant, to the elder people, and the nature of the warfarin is acidic drug. The nature of warfarin is acidic drug. But what happened in the elder people? Due to age, the albumin is, the serum concentration of albumin is decreased. So when we give this warfarin, it is not able to bound to the albumin, and the, so where is the drug? It is not able to bound, so it is free. It is available as a free, and this free drug is responsible for pharmacological actions. Let us use the amount. Example: in normal people, in the adult people, normal, adult, not elder. Adult people, if we will, warfarin is 90% bound to the albumin and only 10% is free. 10% is free, and this 10% is responsible for the pharmacological action. Okay. In normal adult, if we give the warfarin, 90% will be bound to the albumin and 10% is free, which is responsible for the pharmacological action. Okay. Same drug, if we give to the elder people, but in the elder there is a decrease in the serum albumin concentration due to age. So what will happen? Only 80% will bound to the albumin and 20% is free, which is double as compared to adult. So it will double the dose, increase the concentration, which is responsible for the adverse effect, and warfarin is responsible for the bleeding events in the elder peoples if there is decrease in the serum albumin level. In adult, only 10% is enough, but in 10% of warfarin, which is free, is enough for the pharmacological action. But in elder, due to age, serum albumin is decreased. Only 80% is bound to the serum albumin and 20% is free, which is responsible for double the concentration And if we double the concentration, it will leads to adverse events. And what is the adverse effect of the warfarin? Bleeding events. Okay. Fifth effect, in elder people there is increase in the alpha 1 acid glycoprotein. And this alpha 1 acid glycoprotein, most of the basic drugs are bound to the this alpha 1 acid glycoprotein. Basic drugs are bound to the alpha 1 acid glycoprotein. It is increased. So now it is reverse. In the first case, the increase in the serum albumin, sorry, a decrease in the serum albumin. So acidic drug is not able to bind. But in the next one is increase in the alpha 1 acid glycoprotein. So it will causes the increase in the binding site. So it is a reverse. What is the effect? It will decrease the concentration of the free part of the basic drug like propranolol. Let us see the example. Suppose, as we discussed, adult people, not elder, adult. If we give propranolol and 75% drug is bound to the glycoprotein, and 25% is free, responsible for the action, pharmacological action. But in elder people, example, in elder people, there is increase in the alpha 1 acid glycoprotein. So what will happen? The propranolol, instead of 75% bound, it will bind up to 85%. How many? 85 or 90%. So what is the available free drug? Free part is only 10 or 15% available. So decrease the concentration of the free part. It will only available 10 or 15% instead of 25% as in adult. Why? Because in adult, due to age, there is increase in the glycoprotein part. So instead of the 75% of the propranolol, most of the 85 to 95% will be bind, and only 10 to 15% is free, which is available for the pharmacological action. So we can say decrease the concentration of the free part of the propranolol. Okay. Next one. Now, same as we discussed, there is one question. The loading dose of digoxin should be reduced in elderly. Explain why. The loading dose of digoxin should be reduced in the elderly. What is the digoxin? These are the drugs which are used in the management of the congestive heart failure, heart disease. Loading dose means, loading dose is the first dose should be given in the high concentration, and the other dose are in the normal concentration. What is the loading dose? The first dose should be given high concentration, and the other dose are in the normal concentration. It's called loading dose. Load means jada. First dose jada as compared to normal dose. So loading dose of the digoxin should be reduced in the elderly. Generally in the adult people, the management plan contain the loading dose of digoxin is higher. But in elder, it should be reduced. Why? Because this digoxin generally concentrates into the muscles, and in the elder, the muscle mass is reduced. In elders, muscle mass is reduced. So the drug is not able to concentrate into the muscles. So volume of distribution will be decreased. The volume of distribution will be decrease. That's why the loading dose of digoxin should be reduced in elderly. Because let us see here, also digoxin is a water soluble drug, and in elder there is decrease in the body water, so volume of distribution will be decreased. And if the volume of distribution is decreased, volume of distribution will be decreased, there will be increase in the plasma level, and it will be responsible for the adverse effect. What is the effect for digoxin? Digoxin is a water soluble drug. In elder, the body water is decreased, volume of distribution is decreased, which leads to increase the plasma level, which is responsible for the adverse effect. Digoxin concentrate into the muscles, but in the elder, the muscle mass is decreased, volume of distribution will be decreased, and increase the blood plasma level of the drug, which leads to the adverse effect. As we discussed, this diazepam, which is a lipid soluble drugs, and it will give prolonged effect in the adult because the body fat is increased in the elder. And there is also increase in the effect of drug which are bind to the albumin binding, because what happened here, the diazepam, the albumin is decreased and the free part is increased, as I discussed. Now the drug metabolism. Generally the drugs are metabolized by the two phases, phase 1 and phase 2. Phase 1 includes the oxidation, reduction, hydrolysis, and phase 2 conjugation. Let us see what is the effect of metabolism in elder. What is the age associated changes in the elder? Decrease in the size of liver, decrease the hepatic blood flow, decrease in the phase 1 enzymes. See, decrease in the phase 1 enzymes. So, decrease the metabolism, and as we know that if the metabolism is decreased, the drug is not able to excrete. Where is the drug in the body, and it increases the level of the drug, leading to increase in the pharmacological effect, increase in the drug toxicity, and it also increase the prolong the pharmacological uh, effect, increase and prolong. But phase 2 metabolisms are not affected. Phase 2 metabolisms is not affected in the elder, only phase 1. There is a decrease in the activity of phase 1 enzymes. So the drugs which is metabolized by the phase 1 should be avoided in the elders, and the drugs which is metabolized by the phase 2, no problem, you can give the drugs which is metabolized by the phase 2, because the phase 2 metabolisms are not affected in elder. So why the first phase 1 metabolisms or the drugs which is metabolized by the phase 1s are avoided? Because in the elder people, the phase 1 metabolism is decreased due to age. The phase 1 metabolism is decreased in the age. Now there is one example, diazepam, which is generally used in the management of the anxiety, and it is a sedative drugs. It is metabolized by the phase 1. So we should not give this drug to the elder, because the phase 1 metabolism is decreased in the elder. Instead of diazepam, his small brother from the same category is lorazepam, which is also having the sedative property, anti-anxiety property, should be given to the elder people instead of diazepam. So we have to use lorazepam because it is metabolized by the phase 2, and phase 2 metabolisms are not affected in elder.